Dr. Sergio, for breast implant replacement, how do you safely remove the old implants?
It's a common operation we do, removal of an implant that's been put in maybe 15, 10, 20 years ago, even longer, is not an uncommon procedure. What it requires is to go through the incision, through the fold, and the incision is about so long, about 4 centimeters. And with that, I then enter the fold, dissect under the breast tissue, and enter where the implant sits, whether it's above the muscle or below the muscle. I'm directly onto the implant as opposed to going through the breast, and then finding the implant. We identify the implant, make sure it's not leaking. If it is leaking, then we have to proceed with a different set of rules because we have free gel. That's not the case here. We're just removing an implant that is intact, but for whatever reason the patient wants to change, to either go bigger, go smaller, take them out altogether, or change them to gel because they were saline implants done years ago. And once that step is identified that we have a clear, present, and intact implant, then we remove the implant carefully, inspect the pocket where the implant is in position, whether it's under the breast tissue, under the muscle, the pectoralis muscle. I inspect the area and then proceed to place the new implant in. And typically it's a gel-filled implant. And again, the parameters the patient wishes. No implant, larger or smaller or the same size.